Hello, welcome back. In this video, I'm going to be going over some of the basics of soap charting. Now, I know you're watching this video because of how much you love charting. What nurse doesn't want to spend hours out of their day writing things down by hand? Okay, so maybe that isn't exactly why you're here. Whether you're new to soap charting or have been using it for years, I believe it's good to go over this information. It's imperative that if you are just starting out using soap charting, that you form good habits right from the start. And for those of you who are experienced soap charters, sometimes we can forget some of the important points that need to be included in each soap note. And I'm speaking for myself here as well. I know what it's like to get to the end of a long, busy day and think, ugh, do I really have to follow the format? So many of the other entries in the charts don't. But that's why we're here today, to ensure you have the information and tools to write clear, thorough soap notes. Which brings me to my next point. At its core, like all charting, its purpose is to communicate information to other health professionals, such as your nurse colleagues, as well as physicians and NPs. It supports safe, appropriate client care and provides evidence that you're practicing within the BCCNP standards of practice. In addition, it provides evidence of your assessments and the care you provided so that if, at a later time, the case was reviewed by a practice support team, it's easy to tell that you were practicing appropriately. Okay, so let's jump in. SOAP is an acronym. The S stands for subjective, or what the patient is telling you. The O stands for objective, what you are observing. The A stands for assessment, what is your diagnosis, and the P is for plan. Under each of these sections are key headings that must be included. Remember that old adage from nursing school, if you didn't chart it, you didn't do it? Soap charting is based on that premise. The headings to include under subjective are CC or chief complaint. This is why the patient has presented to the clinic. It's often helpful to use a direct quote from the patient here. HPI and ROS stand for History of Presenting Illness and Review of Systems. This is your symptom review. How long has the health issue been going on for? Has it happened before? Does anything make it worse? And under your review of systems are your more global questions such as fever, weight loss, trouble sleeping, etc. These two are often difficult to separate and can be placed together under HPI/ROS. Then, and this is the tricky bit for a lot of people, your past medical history, allergies, medications, and social family history. Many nurses ask, this information is already in the chart. Why do I need to note it down in my soap note? Again, this goes back to the if you didn't chart it, you didn't assess it. And also, it's a good check on practice. Always, always, always get in the habit of marking these headings down and filling them in. It's best practice and a soap charting requirement. Objective. It's helpful not only for you, but for anyone following you to arrange these by system and under headings as well. I'll provide an example later on of how much easier it is to find information if you arrange under headings than if you simply run all the systems together. Trust me, the nurse that sees the client in the middle of the night after you've seen them earlier that day will thank you. Assessment. This is where you put down your diagnosis. And this may seem obvious, but you'd be surprised. It has to match what you've assessed for. Don't put query tuberculosis if all you focused on was an MSK injury. And what do you do if you aren't sure of your diagnosis? Let's say, is it a viral or bacterial pharyngitis? You can put pharyngitis query viral versus bacterial. Plan. Number these. Include any diagnostic tests that you will be sending out. Remember, any diagnostics that you do on-site, such as a urine dip or pregnancy test, should be included under your observations. Under the plan is also non-pharmacological interventions, pharmacological interventions, patient teaching, and any follow-up. Okay, so let's look at an example of this. Remember the assessment form I mentioned in an earlier video that I told you we would be coming back to? Well, here it is. We're using it to keep our notes on as we see a female patient who has come into the clinic. She states, "It burns when I pee." As we're doing her history of presenting illness and review of systems, she tells us that it has been burning when she pees for 2 days, and she's been having frequency and urgency. There's no foul smell or blood that she's noticed, and she isn't having any flank pain or nausea. She has had bladder infections before. Her last one was 2 months ago, and it was treated with Macrobid. She states this cleared it up. No other UTIs in the past year apart from that one. She states no past medical history. She takes a multivitamin, but no other meds. She has an allergy to sulfa, which gives her hives, and she is not sexually active. Okay, so now let's have a look at how this assessment form transfers over to what your SOAP note should look like. Notice how I've written down each heading in bullet form. This will leave you with some blank spaces that you will need to put lines through, but it's much easier visually to follow. There will be an example at the end of this video illustrating this. I know I mentioned earlier a common corner that gets cut in the subjective section is to not include the past medical histories, allergies, etc. Often, however, the chart has not been updated, so referencing see medication list or see client profile under these headings simply indicates that you did not ask if they had allergies or what their medications were. For your physical assessment, you note that she has a blood pressure of 125/87, a heart rate of 85, resp rate of 12, temp of 36.8, SATs at 98%. You dip her urine and find +3 leuks and positive nitrates. She has mild suprapubic tenderness, but no flank pain or costovertebral tenderness. You decide that she has a lower UTI. As per the decision support tools, you are going to send out a urine specimen for analysis. You advise her to rest if febrile and increase her water intake. If you are remote certified, you are going to independently dispense Macrobid. If you are not remote certified, you would be consulting for this medication. Make sure to write down the medication exactly as it appears in the DST or as ordered by the physician or nurse practitioner, and include the number of pills you actually dispensed. Make sure to note down when you have instructed the client to return to the clinic, and I always include or if any concerns. So you can see how the assessment form can help remind you when you're doing your charting what headings to use and how to organize your SOAP note. Here's an example of a pediatric SOAP note. As you can see from the first example, it's sectioned into headings: easy to read, easy to find information. In the second example, there's no use of headings. Now, I want to be clear, all the information is there in the second example, which is the main thing. But imagine this child comes in at 2 a.m. with a febrile seizure, and you were not the nurse that saw him earlier that day. Which note would you rather look at to see what the assessment had been earlier? And here's the subjective portion of that same SOAP note. Note how headings are used and lines drawn so there aren't blank spaces. I'd also like to draw your attention to a couple of other aspects in this note. Under social/family history, this is a good place to note down for any infectious processes, if anyone else is ill at home, and any other factors that may contribute to the clinical picture, such as overcrowding in the home, exposure to secondhand smoke, etc. It's also always a good idea to note down the child's immunization status. That brings us to the end of our SOAP charting video. If you have any questions or would like further resources on SOAP charting, please let us know.